2 works for you starts now with breaking news.
Good afternoon. I'm Corey Dick. We're cutting into programming right now to bring you some breaking news. Oklahoma Governor Kevin Stitt is giving an update on the state's response to coronavirus. Let's listen in. Oh.
Thanks for joining us today. I wanted to start first and really just honor and thank our healthcare workers, our doctors, our nurses, all the medical staff that are on the front lines helping us through this crisis and taking care of our COVID-19 patients all across the state. They're doing a wonderful job, and we're just continuing to pray for their safety. And we've been visiting their hospitals, and we're doing everything we can to support them. They're doing great. Right now, people are really, really anxious about this. A lot of uncertainty, a lot of fear. But I'm just here to tell Oklahomans we are going to get through this. We are doing a fantastic job of our social distancing, and so just continue to follow the guidelines. That's when we're trying to give updates every single day to let you know what's happening. But Oklahomans are doing a really good job. We're taking this very, very seriously. But the reason we're here today is to update Oklahomans on how we're expanding our ability to perform COVID-19 testing all across our state. Oklahoma State University's research lab in Stillwater received 10,000 reagents or test kits yesterday, and I was in Stillwater. I wanted to put my eyes on them and see that test, see those 10,000 cases that came in. So now we have that ability to test 10,000 right here in the state of Oklahoma. I want to specifically thank President Burns Hargis, also Secretary Casey Schrum, all the faculty, the staff, the graduate assistants at Oklahoma State who worked around the clock to pull this off really quickly as we're competing for these test kits against all other states. Oklahoma State did a great job of getting those in. Oklahomans should be proud of the work all of our research universities are doing through this unprecedented situation. Right now, we have 3 different labs that are able to do COVID-19 testing in the state. We have the State Health Department, we have Oklahoma State University, and we have the University of Oklahoma, all able to perform COVID-19 testing in the state of Oklahoma. I've also instructed experts at our research universities to come together with our state epidemiologist, our state health department, to perfect the modeling and help booster and confirm all the modeling that we're doing that is predicting our hospital needs, our ICU, our ventilator needs, in hospital capacity that we're going to need as we're affected and impacted by COVID-19. We're also rolling out mobile screening sites all across our state, and I'll let Secretary Lockridge tell you a little bit about that in just a few minutes. Before I turn it over to Secretary Schrum, I want to remind Oklahomans how important it is to follow the CDC guidelines. There's, social distancing. We have to make sure that we keep our distance from others. That's the best way to keep this from spreading, because some folks will not have symptoms, but it's so important that through this time we keep our social distancing. We avoid groups of 10 or more. We sign that executive order. We stay at home when possible. We sign an executive order for our vulnerable population all the way through April 30th they're safer at home, and unless they need to be out for essential travel, going to the pharmacy or the grocery store, we know that vulnerable population is safer at home. And I know that this is a very difficult time for our state. So many of you are at home watching or listening to this broadcast right now. But remember, we're going to get through this. But for the time being, we have to keep our social distancing. We've got to follow all of the recommendations. And it's my goal to get Oklahoma back to a regular life as soon as possible. If we all pull together in this time, we can prevent the prolonged pain to our state, both from the virus and from the economic stranglehold that's happening through this. So we will get through this together. Oklahoma is going to come out of this stronger. Thank you for taking this seriously, Oklahomans. I'm hearing from all across the state how businesses we're working from home, we're innovating, we're coming up with new ideas of how to keep the social distancing. So thank you for that. Now I'd like to turn it over to Secretary of Science and Innovation, Dr. Casey Schrum, to talk to you more about the testing capacity. Dr. Schrum.
Thank you, Governor Stitt. We were very pleased with the progress we made yesterday in receiving the reagents into the state. Expanding our testing capabilities are vitally important and foundational to our success in managing this crisis, and seeing that occur yesterday as a part of our moving forward strategy, that we are staying on our timelines and moving forward, working through both commercial and federal avenues to obtain the very important reagents. The collaboration between the State Health Department, OSU, and OU are the important piece of this. They are working together all as one state Department of Health laboratory and meeting daily to work through each day how to operationalize and better turn around lab times, get tests out to Oklahomans more quickly. As a part of really just clarifying what occurred yesterday, I know there's been a lot of questions around what is a test kit, what happened in Stillwater. So to clarify, if your provider orders a test for you, that is a nasal swab that is done, and that specimen is sent to one of the state labs for testing. Now, what occurred yesterday is that in order to run and process a lab, you have to have what is called reagent. That's a very important piece of material. All states across the United States have been struggling trying to get that reagent in order to run the labs. And so regardless of where you live in Oklahoma, our goal is to turn around those lab times. You still get your test performed wherever your provider is, but through our 3 sites of our state testing lab, we will be able to do those tests right here in Oklahoma. Our goal is to turn those around within 24 hours. Now, our testing priority is going to continue to be hospitalized patients, because it's very important that we know the status of hospitalized patients so that we're not burning through protective equipment for our frontline healthcare workers unnecessarily. We're still going to be focusing on testing those vulnerable populations and healthcare workers. But as we expand our testing capabilities, our goal is to really get those out there into the communities so that we can identify those positive cases and beginning isolation and slowing down the transmission. The questions are how do you get tested? If you're an Oklahoman and you are symptomatic, you should contact your healthcare provider. Let them know what your symptoms are, and they will help you in the screening process and guide you through that, whether you need testing or not. If you do not have a healthcare provider, you can contact an emergency room, but please call ahead and call through the hospital. We want to make sure that we know what patients are coming in and with what symptoms, so we're not unnecessarily exposing others to the virus. If you're not symptomatic, but you know that you have been exposed to a patient who has tested positive for the COVID virus, you need to go ahead and begin self-quarantine immediately and contact your provider. They will assess your situation and advise you of your need for testing. But it is so important that if you believe you're exposed, to quarantine yourself. But in all, I believe that what's most important and what we need from all Oklahomans is for you to help us decrease the transmission of the virus. Sadly, we know that we have lost Oklahomans to this virus, and we know and can anticipate that this will continue to happen. And so I implore you to follow the CDC guidelines, stay at home when you can, and monitor if you have symptoms, start your self-quarantine. It is vitally important, and we are relying on you to help us slow the transmission of the virus so that we can be prepared and our healthcare workers will have the capabilities to take care of your family and friends and loved ones if they should need it.
Thanks, Dr. Schramm, for that explanation. If I could, I'd like to provide a little context on our satellite or our mobile locations. So as we stand now, we have 2 locations that are staffed, stood up, manned by our Oklahoma City County and Tulsa City County Health Departments. We have a close collaborative partnership with those 2 entities. And as we speak, their 2 locations, again, are manning and staffing testing for Oklahoma and Tulsa counties. In addition to that, the state stood up at the first part of this week 2 other satellite locations, one in Kay County and one in Pittsburgh County. And I wanted to describe in a little bit of detail the purpose of those. Our testing capacity has expanded by virtue of the work of Dr. Schramm and her colleagues, which has truly been exemplary and extraordinary in terms of alleviating really global disruptions to the supply chain. But these satellite locations were not aimed at increasing testing. They were aimed at 2 particular purposes. One, to give us a sense of what was happening in populations outside of Tulsa County and Oklahoma County. That we've been able to do on a limited basis to get a sense of transmission rates and the like in those locations. And then in addition, what it allowed us to do was to get some practice on standing up mobile locations that we can now replicate across the state, most particularly in rural areas. By doing this in Kay County and in Pittsburgh County, we've now developed a model that can swiftly be spun up and moved to other locations. And within the next 4 days, we will have moved those 2 locations out to the western part of the state, one in the northwestern quadrant and one in the southwestern quadrant, which will continue to allow us to practice, to hone our ability, and then to address outbreaks that might occur in our rural locations. Now, what happened to those 2 in Kay and Pittsburgh County is those were subsumed by the existing county health networks, of which Oklahoma has 68 that are strong and robust and have been practicing for outbreaks for years and years and years. So this effort for satellite or mobile testing has just been to supplement and to amplify what existed through our already functioning county health departments. We wanted to provide that bit of context to clarify on some misunderstanding of what might have happened. The actual physical way that these happen in the satellite clinics is they are indeed drive-through. They will swab individuals who are referred by virtue of their symptoms, and then the tests will go back to our testing labs already referenced by Dr. Schramm. So these will be appearing again in the northwest and southwest parts of our state to augment both our testing capability, our reach, and then also to make sure that we're reaching our rural community as well. I believe at this time we're turning it over to questions, Governor.
Yes, that'd be great.
Carmen Foreman, you're open for question.
Oh, I'm not sure I had a question at this time. Did I raise my hand? Sorry.
Awesome. Sean Murphy.
Oh, thanks. Governor, I'm kind of curious why the state epidemiologist is not attending these briefings anymore.
He's probably working on modeling right now. We also have, I've brought in Oklahoma State and the University of Oklahoma to help perfect the modeling, but we can get him involved. If you've got specific questions for him, we'd be happy to get him involved. But right now I have them kind of hold up perfecting the modeling, because that's going to determine our hospital needs, our ICU needs, our ventilator capacity. And so really, I've given the state epidemiologist, OU, OSU, we have to challenge, we have to get that number right. And I've given everybody through Monday to kind of come up with that, with those final numbers for me. So I'm sure he's holed up doing what modelers do right now.
Janelle Steckline.
My question is, there's a perception that some of the early tests were reserved for those with political influence or people who had money or were well connected. Is that going to change? First of all, do you agree with that perception? And are tests going to be more widely available now that we have more of them?
Okay. Well, I would say that, the goal of any testing and through the state lab, our focus here is what occurs at the state lab, and the state lab is intended to focus on the hospitalized patients, vulnerable populations, and healthcare workers. And then as we move forward, We will continue to expand that capacity as we have outbreaks. What occurs at private labs or ordered through physicians, I don't believe I can comment on, but I can comment to the strategy and the goals of the state lab.
And just to add on to that's why we're here, is to let Oklahomans know we now have 10,000 test kits available within the state's control of OU, OSU, or the State Department of Health. But great point. There's private labs all over that hospitals would send out. The turn times could be up to 7 days, and that's why it was so critical. That's why we were really pushing to get our test kits here. So we can, and Dr. Schrum, we can turn these test kits around now in 5 hours. So that's really significant for our healthcare workers, for our hospital needs, so we're not burning through the protective equipment.
Yeah.
Dylan Richards, open for a question. And then we'll go, to Ben Felder.
Yeah, Governor, you said we're competing with other states for the tests. Can you speak to what steps you and your team are taking to improve Oklahoma's ability to get more tests? And Dr. Schrum was just credited for her work on this front. What exactly does that work involve?
Yeah, so as we were looking at, as the governor stated, that there is a shortage of reagents. Through the federal government, the state health departments are allocated testing materials, but as you can see across the United States, we're all trying to get a hold of that depending on the platform. And so very early on, I brought on Deputy Secretary Pollard, and she and I have looked at what are our capabilities to go out to the commercial laboratories, also to look at what were the platforms that we had here in the state, and who was supplying those particular platforms. And what we found was we were looking for companies that had their manufacturing here in the United States that we may have had current contracts with, because if you have a current contract and you are already receiving supplies from that company, you become a priority. So we have not given up on going after the supply through FEMA. We're pushing that direction, but we also have a strategy about what testing platforms both OU, OSU, and the state health department have, and really looking at the supply chain to understand what companies we needed to focus on to get out in front, and we could actually get the reagents here in the state quicker so that we can turn around those tests to Oklahomans within 24 hours.
Trace Savage, you can ask a question.
Governor, can you, or Dr. Schrum maybe as well, can you speak to the value that is the efforts that are being undertaken by OSU? And I joined just a few minutes late. I'm so sorry. But so maybe you already talked about this. But if you could talk a little bit about the specific labs, the federal approval you had to get, and the role that that OSU is specifically playing in this effort.
Yeah, so as under this emergency condition, the federal government allowed for certain waivers in order to bring external testing sites that were research laboratories underneath the state health department to expand our existing capabilities. And so, as I said, we got together, really looked at a strategy of, first of all, what labs actually in Oklahoma had the capability, had the equipment to run these tests that we needed, and what was the platforms, the companies, where were they getting the supplies. And what we found was that there, amongst our 3 labs, there's a variety of different platforms, but OSU has the capability to do automated testing, which means high throughput, meaning that in other labs you have to manually create the reagent and put it into the test. OSU has 2 automated machines that allows them to do this very quickly, and they were also utilizing a platform that we believed we could get the reagents quickly on. And so we executed very quickly to do that. OSU has been great in transitioning and working with us to put that in place. The State Health Department, as well as the OU labs, all working together to put processes in place so that we can process those labs and get them out. So it really was a matter of what equipment was available, who was already doing high throughput testing, and how we could execute on that in a very quick manner.
OSU, you are now open to ask a question. KOSU. Okay, we'll go to Paul Monies.
Hi, Secretary Lockridge, do you have a good idea of what the ideal number of ventilators are for this state? Last count we had 751, because I just want to kind of see what details we might have and what we might need going forward as this gets a little bit.
Paul, I'm gonna infer that your question was about, I did hear ventilators, so let me go with that. If we don't hit the mark on that, we'll have you repeat the question. But I believe the question was, how do we sit with respect to capacity on ventilators? So the state has a store of about 800 odd ventilators across the state. We don't believe that that will necessarily, as they sit now, be sufficient, and therefore are moving quickly, both from the state side to source ventilation capacity for ICU beds, but as well the supply chains of existing hospitals and other medical centers are already underway. Dr. Shrum and I were at the University of Oklahoma OU Medicine yesterday. They have already amped up their own supply chains to meet what we believe will be the forthcoming demand on ventilator capacity. So I would say this, much like testing, is a multi-partite attempt to make sure that we have adequate supply at such a time as we need them. So I'd say that that's well underway. We don't anticipate, like any other state or any other locality, that as we sit now there would be sufficient as they sit in the hospitals, but neither have we been waiting. That's been underway now for days, that effort to make sure that we have ventilation capacity.
This question is from KOSU. Secretary Lockridge, you mentioned starting satellite testing sites in Northwest and Southwest Oklahoma. When will
in the next 4 days, and we're going to hold tight before stipulating exactly where they are. Again, we're going to try to make sure we reach the northwestmost part of the state and the southwestmost part of the state. But if you'll allow us a little bit of time to make sure folks on the ground are prepared for that to come their way, we'll be happy to share details with you really in the next 24 hours to be sure.
Randy Crable, you are open for a question.
I understand that, well, you'd mentioned earlier that you're paying more attention to the modeling, you're looking at the modeling, and I think some other people have raised questions about that. So what are some of the specific problems or potential weaknesses you see in the modeling that the state has been using?
Well, I wouldn't say there's been any specific problems that the state's been using. We're still getting our arms around as this is changing so rapidly, as we've getting more and more tests come online, as we're watching what's happening in other states and other countries. Those factors all feed into our model, and so really we're just trying to finalize where we think our peak's going to be. When we think our peak is going to be, and that will drive our decision making on hospital beds, ICU, ventilators, the PPE, burn rates that we're going to be looking at, our ordering. Everything falls off of where we're going to kind of land on the modeling side. So they're working on it. We're challenging. That's why I wanted more eyes and more focus around it. I've talked to other governors on how they're modeling their state needs. So we're right in the middle of that right now, and we're at the same time we're following the CDC guidelines. We ramped up some of my executive orders earlier in the week to continue to flatten the curve as we are trying to give us time to build up our PPE and our eventual needs in the hospital capacity.
Rick Marinon with Fox 23.
Governor, I've got a quick example. Can y'all hear me?
Yeah, go ahead. Okay. We can hear you just fine.
I've got a quick example, and then I'll ask my question. I won't take too much of your time. Sorry, we've got the dog here. We have an auction house in East Tulsa that has packed 50 plus people in for an auction today for used cars. They are listed as essential under your order, but at the same time, it's violating the group of 10 order, part of the order as well. I'm wondering if you think your essential list is too big and too, I guess, friendly to too many businesses to accomplish what you're trying to accomplish.
So we're following the federal guidelines on what is an essential and a non-essential business. And over the last couple of days, we've given more clarification of that because there was a lot of, we just were getting tons and tons of questions for what is an essential and non-essential. But first off, we're following the federal guidelines. Secondly, if there are businesses that are gathering with 10 or more, that is in a violation. And so if they are an essential, it doesn't mean that they should gather with 10 or more people in groups. They have to spread out. They've got to do stuff online. That's been our directive across the country, across our state. And I know that's the directive from the president across the country as well.
Erica Stanish.
Yes, my question is, what really has taken Oklahoma so long to get enough testing kits and to set up these mobile locations? I mean, compared to other states, and just a survey done on New York Times today, we're second to last in the country right now compared to other states. I mean, to me, I feel like we need to be trying to get these as soon as we can. So what has just taken so long for Oklahoma?
Well, I would say, first of all, we've seen the outbreak occur in other states quicker. And as we started going through our reagents, you have to recognize that through FEMA is where the state was getting their supply of reagents. And so as other states are hit more quickly, the supply chain tightens down. And while we might be promised reagent, we might not be first in line to get that. It could have been delayed. And so to be honest, when we recognized that we were having those challenges, our turnaround time in getting reagent was very, very quick through the commercial side. I'm very proud of our team and stand behind the work that they did in getting the testing capabilities up and running. You also have to recognize that, it's a fluid situation and we're following federal guidelines. And so once they loosened those regulations and allowed us to identify external labs, which expanded the platforms that we were using and therefore the reagents that we could go after, we executed very, very quickly.
Dylan Richards with KOCO.
Hey folks, hopefully you can hear me this time. We're just having audio issues. My question was about, I know we're looking at these mobile testing sites and the fairgrounds right now, I know is Oklahoma City County Health Department's deal, but maybe one of the secretaries knows, but what is the timeline? What is the plan to bring that type of drive-through testing that's kind of open to the public to the metros?
Okay, thanks for the question, Dylan. We will continue to prioritize those people who do exhibit symptoms, certainly those who are in the highest risk categories. That is, for the avoidance of doubt, the elderly, age 65 and older, and those with compromised immune systems, as well as, of course, the hospitalized. So those will continue to be the priority. We would not want the public to have the notion that if someone simply isn't feeling good, that they ought to go use one of these critical tests. Again, we've done incredible work on increasing our test capacity, but we still must be judicious in its application such that it's safe for those people who are really in need and who exhibit the symptoms of the type that warrant the use of some of these precious resources. All that being said, I think that we will, as testing capacity becomes available, we will continue to push those out both into the metro areas, but also into rural areas. We try to keep a supply in each of our county locations that they can draw on, and some of them, even as we speak, are using what could be styled drive-by methodologies for getting people swabbed and then ultimately testing. Our priority through all of this is to make sure that our healthcare workers' safety and health is preserved. Again, we can't emphasize enough, to the extent our collective efforts at social distancing and personal hygiene protect the frontline healthcare worker, we will have done our job on both flattening the curve and preserving our healthcare capacity for when the surge actually hits.
I would also add to that in the metropolitan areas, you will likely see as more testing capability comes available, not just through the state, but through the private labs, that the health systems will also implement on their own testing sites.
Randy Ellis.
Yeah, I had a couple of questions. One, we're hearing that perhaps there's a whole lot more people in the hospitals with the COVID than the numbers released by the state health department reflect, possibly because they're reserving tests. They don't figure it's going to make much change in the way they treat the person. Do you have a sense of that? That's my first question.
Well, I think what we have been tracking, what we would call persons under investigation, and we know that we have patients that are hospitalized that are suspected to have COVID. What you have to understand early on, when the testing capabilities, before we recognize that, we got a backlog. So some individuals that are in the hospital that meet criteria to be tested, and again, we're going to trust those healthcare professionals that are in that facility. I fully believe that, if there's a patient that they suspect, they want those patients tested. But what happened is some of those got sent out of state, and there's a delayed time in return on some of those lab tests. And so what we're trying to do is increase the capability and the capacity inside the state so we can turn those around within 24 hours. So that goes back to the testing priorities that I stated earlier, being the hospitalized patients, the vulnerable population, and the healthcare workers.
Is it your sense that there's maybe as many as 600 or something that are hospitalized with the virus right now, or?
We don't have that many confirmed. We are monitoring the number of labs pending, but I could probably get back to you on that number. But my sense is that we're not at 600 at this point in time. Secretary Lothridge, do you have any other data?
Right. Yeah. I thought it was closer to 300 that was pending in the hospitals, and we're waiting. And just to clarify your question, so they are tested. If they're in there and the healthcare providers think that they have the symptoms of COVID-19, they are tested. This is why the testing in state is so important, because we're waiting for 7 days as some of those went out of state. That's why it was such a big game changer to get those 10,000 test kits in our state, because we want to make sure we can get those tested immediately. We know who is positive and who's negative. That also saves on PPE, because our health professionals having to go in and take care of those patients if we're not positive what they are. It's also burning through the protective equipment as well.
Yeah, and that's a very illustrative of the nationwide kind of shortage and demand for reagent, and how much everyone is utilizing that and sending those labs out of state. We want to make Oklahomans a priority and do it right here.
This will be the final question. Carmen Foreman.
I'm just curious. I assume that either the State Department of Health or Oklahoma State University had to pay for these 10,000 test kits in some way or another. And so it's sort of a two-part question. I'm curious how much we paid for those, and two, is that how Oklahoma is sort of getting ahead of some of the other states on this? Are we paying more? Is this sort of turning into a bidding war in a way?
No, it's not turning into a bidding war. I think we were fortunate, as I stated earlier, that OSU already had a contract with Thermo Fisher, because they were already utilizing their platforms in their labs and doing testing there. And so we were able to expand and be prioritized our orders through OSU to allow us to increase our capacity to do testing through the state health department.
Well, Governor Kevin Stitt just updating Oklahomans on the ability to expand testing across the state. The state now has the ability to test 10,000 people with those new kits, and they're also saying that the results could return within 5 hours. The Secretary of Science and Innovation, Dr. Casey Schrum, spoke to the importance of the 3 labs that are testing across the state. That's Oklahoma State University, the University of Oklahoma, as well as the state health department. And she also wanted to clarify just how those tests work. You will still go to your provider, but then your test will be sent off to one of those 3 labs.